Welcome to this review video. For this video, I thought it might help for me to review the answers to one of the worksheets that I'd made before on the classification of common cocci you would find. And first, you might want to make sure that you go back and understand a lot of your basic terminology. And a good place to find this would be your assigned text, MyAll, pretty much any of those standard resources you can find these in. You might want to make sure you know words like normal flora, normal microbiota, and which members of these organisms fall in that category. What the enzymes catalase and coagulase do, the difference between aerobic and anaerobic organisms. We do have some sort of nicknames that we refer to for some of these organisms. So pneumococcus stands for our Streptococcus pneumonia, gonococcus, our Neisseria gonorrhea, and meningococcus, our Neisseria meningitidis. You might also see the abbreviation GAS used frequently, and that stands for our Group A Streptococcus, also known as Streptococcus pyogenes. And so, as we'll see in a minute, many of our streptococci are grouped or classified by their C carbohydrates in their cell wall. And these C carbohydrates are very antigenically distinct and therefore can be grouped. And they fall under these different families of strep. So GAS pretty much tells you that it's going to be strep pyo, whereas group B strep, group D strep, things like that are going to usually mean you're dealing with other strep. GU and GU are related to some of the etiologic agents we'll get to in just a second, but that stands for gonococcal urethritis or non-gonococcal urethritis. You might want to make sure that you know what to look for in question stems for your various patterns of hemolysis, such as alpha hemolysis, beta hemolysis, gamma hemolysis. You might recall that alpha hemolysis is when you are going to see a partial hemolysis of your red blood cells. Typically, it's going to be sheep red blood cells, and if you see partial hemolysis, you will often also see like a green sort of clearing where the bacterial growth is. Whereas with beta hemolysis, this indicates a complete clearing. And so you'll often see like a clear or a white patch on the agar plate. And gamma is just means... Oh, did I just do that upside down? I think I did. It's just like, well, we have a category for partial and complete. We might as well give no hemolysis a name too and not leave those guys out. So this is gamma hemolysis. It just means there's no hemolysis happening. So typically with the ones that are beta hemolytic, that usually means they have some sort of enzyme that can help the bacteria lyse these red blood cells. So with chocolate agar, you might want to be familiar with what's in these three common agars we use for identification of these cocci. And these are great trigger words for specific etiologic agents. Ubiquitous versus fastidious. Ubiquitous would mean that a particular organism is found pretty much everywhere. So they're usually associated with bugs that you would find very commonly in soil, water. So we often say that Pseudomonas is pretty ubiquitous, or our soil-dwelling organisms like Clostridium are ubiquitous. Whereas fastidious, and usually ubiquitous organisms, they aren't very picky and they don't need a whole lot. They can pretty much grow in a lot of different places, and they might be a little bit more suited to harsher conditions, whereas fastidious organisms, they are real divas. They're like the Mariah Carey of bacteria, is what I like to say. Like, they are just, you got to provide everything for them on a silver platter. So that's going to be like Neisseria and Haemophilus. Novobison, bacitracin, optokin, these guys are antibiotics. Don't really need to know the mechanisms of action for these specific antibiotics. I would just know that they're commonly used for identification. So we'll see how that applies in just a second. Fermentation is also a great means of differentiating between agents within the same genera. And we can also check and see whether or not the organism can is soluble in bile, to also help differentiate. So here's our little chart. And so again, just want to emphasize, this is only with cocci. Okay. So first let's take a look at if we're talking about gram-positive cocci. Okay, and the way that I'm going to go through this is, before I announce the answer to the blank, I will try to throw out as many trigger words as I can think of regarding that organism, and I want you to try and see if you can guess who that might be before I write the answer on the board. Okay, so if we're talking gram-positive cocci, typically the question stem will tell you if the organism is catalase positive or catalase negative. And this catalase test, so catalase is the enzyme that's going to break down your hydrogen peroxide into oxygen and water. And this is really useful for the guys who have this means of kind of disarming potentially toxic intermediates. So it's when they use aerobic respiration, and some of the toxic intermediates left over can be broken down into harmless ingredients. Also, sort of hand in hand with that, is if you see these cocci described as being arranged in clusters, whereas these guys will often be described as arranged in chains, or maybe even diplococci. Then we're probably looking at this crew. Okay. So this is really the primary test that we use to decide, are we looking at staphylococci or are we looking at streptococci? Okay. So let's assume that the question stem said that it was our gram-positive cocci was gram-positive. Okay. So if it tells us that it's not only catalase positive, but also coagulase positive, it can only mean one thing. So this etiologic agent is this is the etiologic agent of surgical wound infections, abscesses. It's the number one cause of pneumonia after a flu infection. It can also cause toxic shock. Can also cause a foodborne intoxication, not infection, but intoxication. And it's pretty much the main, the one etiologic agent that actually produces a pre-formed enterotoxin, which is actually heat stable. Because a lot of these enterotoxins that we talk about in food micro are often heat label. Since many of these exotoxins are going to be proteins, and proteins can usually be denatured by heat. So, as far as toxic shock goes, it has a super antigen that's responsible for toxic shock. It's also associated with vaginal tampons, infections from vaginal tampons, or nasal packing. So if you see, questions something about a surgery involving the nose and using nasal packing during it, it's also associated with folliculitis, so like inflammation of the follicle, where you have raised areas of carbuncles or furuncles. We know we're talking about this. It lives in your anterior nares. Very, very big clue. Anterior nares it's mainly going to be one guy. This agent is also beta hemolytic, so I would make sure you probably start a list of the major beta hemolytic organisms. So remember, beta hemolytic means you're going to see a complete or clear area of hemolysis. This organism also has many different virulence factors. This guy and this guy is going to be two of our big bad boys. They have so many different virulence factors, and in a lot of different ways that they can cause infections. But among its many virulence factors for this particular agent include protein A, which is responsible for binding the constant region of IgG, the FC region of IgG. We already mentioned the preformed heat-stable enterotoxin. We already mentioned the toxic shock superantigen. It also has some tissue-damaging virulence factors, such as pentonvalentine leukocidin, PV leukocidin, or alpha toxin. These are exotoxins that cause tissue damage, and this sort of tissue damage is something that you might see with scalded skin syndrome, and the key word there was if you see desquamation. It's going to be described as like it looks like the skin is peeling off almost. And last but not least, the name sort of gives it away, but you will also see it turn yellow or gold on mannitol salt agar. And mannitol salt agar is both selective and differential. So it's selective because it's got extremely high salt content, 7.5 to about 10% salt, which most bacteria cannot live in unless it's a halophile like this agent. And the mannitol salt agar also has mannitol, which is a sugar, and phenol red. And so if this organism is a mannitol fermenter, it will produce an acid that will turn the phenol red, which is like a pH indicator, yellow. And the yellow is what gives it away. This is going to be Staph aureus. Okay, because this aureus, A-U-R-A, means gold. So that aureus means like yellowish gold. So that's why it looks yellowish gold on mannitol salt auger. It's a big halophile, really, really loves salty places. And so that's why it can live in very salty meats like deli meats or very sugary, high solute content foods. Okay. So if it says coagulase positive, catalase positive, it can only be Staph aureus. Okay. Now, we group all of the other staph. There's only 3 other staph you got to know. And we group all the other staph under coagulase negative staph. Okay. So, for the organism that is novobiocin sensitive. So remember, novobiocin is another antibiotic that just selects for or helps us identify between the two catalase positive, coagulase negative staph. So this next one, well, both of these coagulase negative staph are going to be non-hemolytic, and they're both going to appear white on mannitol salt auger because they do not ferment mannitol. But what's interesting is also they are both urease positive, which means they have an enzyme that's going to hydrolyze urea. Okay, so the one that is novobiocin sensitive is going to be a normal flora member of your skin. And it can be a common contaminant when you're collecting blood cultures. It's also a common etiologic agent of infection regarding or associated with prosthetic heart valves and hips. It's also known for its biofilm formation in long-term IV catheters. It can also be associated, although it's not the number one cause, it can sometimes be associated with neonatal sepsis or peritonitis in patients with renal failure, because especially if those patients are undergoing dialysis treatment through indwelling catheters. So really the big thing there is the catheter, because it has to penetrate the skin, and it's the contamination of the fomite going through the skin and the biofilm formation that's going to make this an issue. So this novobiocin sensitive agent will be Staphylococcus. Epidermidis, Staph epi. So this is predominant normal flora of your skin. We've got lots of Staph aureus too, but predominantly Staph epi will be on our skin. The next agent, which you could probably guess by now, but it's novobiocin resistant. It's going to appear white, urease positive, but this one is much more going to be normal flora of the female genital tract and the perineum. And its MO is that it's the number 2 cause of urinary tract infections, UTIs, in young sexually active women. And so this is going to be Staph sapro. Okay. Number 2. Can you remember the number 1 cause of UTI? Give you a second to think about it. And hopefully you thought of E. coli. So number 1, E. coli. Number 2, Staph sapro. So that takes care of our staphylococci. Okay. All right. So now oh, and one last note about Staph aureus. If you see the question stem start talking about an association with CGD, this stands for chronic granulomatous disease. And what this is it's a disease in which the patient has some sort of deficiency in NADPH oxidase production. And so deficient NADPH oxidase means you're not going to have oxidative burst. And so you're going to have granuloma formation. And so this is often associated, Staph aureus infections are often associated with CGD as well, because this is very quite pyogenic. Okay. So we'll talk a little bit more about that when we get to immunodeficiency. Now, we get to the catalase negative. So if they tell you that it's a catalase negative gram-positive, so again, we're still at the gram-positive cocci, right? So that means they're going to be purple. Little purple circles that are either going to be in chains or in pairs, right? So these, as you can see, is pretty much split into 3 main groups. Oops, let's zoom in a little bit more. And so these are mainly going to be easily separated by the hemolysis pattern. So this is really when you have a catalase negative gram-positive cocci, you want to plate it on a sheep blood agar, look at the hemolysis pattern. If your organism shows a partial green clearing, that indicates alpha hemolysis. We then might want to take a look at whether the organism is sensitive to the antibiotic uptoken, and or whether the organism will be soluble in bile, whether it will dissolve in bile, okay? So if it's uptoken sensitive and it's soluble in bile, that means this is going to be our etiologic agent of a common cause of adult meningitis, one of the top 3 causes of otitis media and sinusitis in young children. Also a common cause of pneumonia, adult meningitis. It also, some trigger words you might hear referred to this might be that it's lancet shaped. Diplococci. Yay. This is going to be, and it's also got an extremely prominent polysaccharide capsule. And so no capsule, no virulence. That's its most important virulence factor. And because it's got such a sticky polysaccharide capsule, you might remember that with a lot of the ones that have such a prominent, thick, juicy capsule, it also often comes with IgA protease, because IgA happens to be that immunoglobulin that's going to coat your mucus secretions. And so IgA protease might be a pretty good weapon to have with you to counteract that. You might also see the trigger words like rusty colored sputum or rust colored sputum. And also patients who may have had their spleen taken out, so therefore are asplenic. Remember, the spleen is going to be responsible for helping you defend against a lot of these, especially these bacteria that are going to try to attach to your mucus secretions with their juicy capsules. So these are associated with asplenic patients or patients who have undergone splenectomies because they're more vulnerable to them. It's also associated with sepsis in sickle cell disease patients. This is going to be Streptococcus pneumoniae. Okay. All right. Okay. So then if they tell us that it's actually uptoken resistant and not soluble in bile, then that can only mean, and it's not typically described as a lancet-shaped diplococcus. I mean, it's not described as lancet-shaped at all, but it's still going to be described as alpha hemolytic, which means you're going to only see a partial clearing. So this is associated with one of the number one common infections in the U.S., dental caries. So when you see trigger words like dental caries or infective endocarditis, you want to think of this organism. It lives in the human oropharynx. And this actually refers to a whole group of them. And a lot of times you might see in some books referred to as I won't give the name away, but you might see them referred to as non-typable strep, and it's because they do not have C carbohydrates that are typable. Technically, strep pneumo also does not have a typable one either. But this group can be separated from pneumo based on biosolubility and uptoken sensitivity. It will involve, it's also associated with dental and oral surgery infections. And it'll include species like Streptococcus mutans, Streptococcus mitis, Streptococcus sanguinis, and this will be referred to as your Viridan group strep. Okay, so your Viridan group strep, and a lot of the characteristics you see with strep mutans, since that's the one that we talk about most often, you can sort of, when you see Viridan group, if you have a hard time thinking of the characteristics of it, try to just think of strep mutans, okay? But a cute way to think about this is uptoken kind of sounds like chin. And these guys live in your mouth. These are normal oral flora of your mouth. And so these normal flora of your mouth are not afraid of the chin. So they are optochin resistant is one way to remember these. Okay, but these guys are both alpha hemolytic. Okay. Next, let's get to our beta hemolytic group. So if it tells you, again, catalase negative, gram positive, so it looks purple on a gram stain, gram positive, cocci in chains. If you might want to test it for bacitration sensitivity to see if it's sensitive to this particular antibiotic, which bacitracin, if you remember from the cell wall antibiotic video, it targets B-bactoprenol, right? So it binds to bactoprenol. So this particular organism is responsible for causing pyogenic infections. Some trigger words you might see associated with it might include strawberry tongue, it's also the #1 etiologic agent of erysipelas and also a common cause of cellulitis. A sort of difference that you can tell between erysipelas and cellulitis, even though they're both tissue skin infections. Cellulitis will appear like a lesion that's not raised, and so the cells that are affected and the cells that aren't will appear pretty indistinct from each other. Whereas for erysipelas, you'll see a very clear, demarcated, raised and reddened region. It's also associated with necrotizing fasciitis, which is your sensational flesh-eating bacteria. There are other agents that can cause flesh-eating bacteria, but this is the #1 cause of it. So that's necrotizing fasciitis. It's also often associated with impetigo. And with impetigo, you'll see the trigger words honey-crusted lesions. A lot of times like around the mouth. And if left untreated, you might see post-streptococcal complications like acute glomerulonephritis, AGN, with impetigo infections. It's also associated with puerperal fever, which I'll put that on the board. Which is a concern. It's an infection of the uterus after delivery, also known as endometritis. And that infection of the uterus can eventually worsen and lead to septicemia, into a blood infection that spreads. That's pretty systemic. So puerperal fever is a giveaway for this. Also, it's associated with scarlet fever. That's pretty pathognomonic for this agent as well. And with scarlet fever, you'll see like a blanching sandpaper-like rash. And so this is going to be our Streptococcus strepio. Also the #1 cause of strep throat. And we'll often also call this gas. So our group A strep. Okay. So it also can cause toxic shock along with Staph aureus. It's also got a million different valence factors. It's PYR positive. PYR stands for pyrrolidonyl arylamidase. And it's just the presence of that enzyme. It also has a hyaluronic acid capsule, which is a big deal because those of you who might have had AMP before, you might remember that our bodies have hyaluronic acid in them. So it's a great way for it to camouflage and evade our host immune system. It's also got a very, very prominent virulence factor called M protein. It's going to cause a lot of issues for us, which we'll get to a little later. Yeah, okay. Then if it tells us that this beta hemolytic gram-positive coccus is bacitracin resistant and that it hydrolyzes hippurate, or that it also produces something called a CAMP factor. So CAMP, not the, it doesn't stand for cyclic AMP. CAMP is just the names of the people who made the test. CAMP factor production means it's going to actually add to or enlarge the hemolysis that you would see with Staph aureus. So it kind of works with Staph aureus as far as hemolysis goes. It's PYR negative as opposed to strep pyo. This is a very, very common cause of neonatal sepsis and meningitis. So that means you really want to think about screening pregnant women who are between 35 and 37 weeks pregnant for this particular agent. You might also see this agent associated with dairy products, and it'll be sometimes referred to as your group B strep. So this is your Streptococcus agalactiae. Okay. Next, last but not least, if the hemolysis pattern is variable, that means you might see beta hemolysis, gamma hemolysis, depending on the conditions. And you can also check for growth on bile esculin agar. It could be the remaining two of the last group of strep. So one of them will actually grow in a high salt condition, so growth in 6.5% NaCl, which makes sense if you think about where you find it, because it's going to involve members that are normal flora of your enteric tract. And these guys are also going to be PYR positive. They will hydrolyze esculin, so they will not only grow in bile esculin agar, but they'll produce a sort of black pigment on bile esculin agar. And so these guys are going to be your group D Enterococci. So that will include members such as Enterococcus faecalis, which is going to be far, far more common in causing infections. These are associated with urinary tract infections, UTIs. They're also associated with biliary tract infections. And this is going to be the main one that you would isolate in most infections, as well as Enterococcus faecium. And these guys are notorious because not only are they more normal flora, so got to worry about them with post-surgical infections, but also they're quite notorious for being intrinsically resistant to many different antibiotics. Okay. Whereas if it does not grow in a high salt content, and it's going to be PYR negative, it might be this agent that often colonizes the gut, and it's associated with bacteremia and subacute endocarditis, and it can be associated with colon cancer. This is going to be your non-enterococcal streptococci. But they still have that group D C carbohydrate. So it's a group D non-enterococci is often what they're referred to as. And that will involve agents like strep bovis. So you can think bovis in the blood associates with cancer in the colon. So it's associated with colon cancer. Okay. All right. So that pretty much takes care of our gram-positive cocci. So once again, just want to reiterate, novobicin helps us differentiate between staph epi and staph sapro. Uptoken helps us differentiate between strep pneumo and viridin group strep, like strep mutans. And bacitracin helps us differentiate between strep pyo and strep agalacti, our group A strep or our group B strep. Okay. And then we've got our gram-negative cocci. And these guys are much smaller group. It's pretty much 3 main genera that you will have to know. Okay. So the most important group are our obligate aerobes. Because they're aerobic, that means they will also be oxidase positive. They're often described as the sugar word kidney shaped or kidney bean shaped. Diplococci. Okay. And they're also referred to as fastidious. So these guys are divas. They are the very, very needy and high maintenance of the bacteria. Okay. So if we can grow it on chocolate agar, and really I should have made this into 3 because Thayer Martin actually refers to, I needed to have revised this. Thayer Martin is pretty much indicative of this. So pretend like this isn't here. And like this is just more like 1, 2, 3. So the first one we're going to talk about will grow on chocolate agar, but Thayer Martin is specific to the second one we will talk about. But for the first one, if it's an aerobe that grows on chocolate agar, it's oxidase positive. This guy will have a very large and thick polysaccharide capsule that's going to help evade host immunity. So it's anti-phagocytic. So avoids getting swallowed up. It's a normal flora for some, for colonizing the human upper respiratory tract. It also has both of these guys have IgA protease. So I'll put that back up there with oxidase as a major virulence factor. Both of these guys also are known for, even though they're gram negative, because remember, gram negatives have LPS, lipopolysaccharide. But instead of the many repeated subunits of the polysaccharide, it's actually got a few. So few or deficient, meaning the term for that is oligo. So it's got lipo-oligosaccharide, LOS. And it's cell wall. So both of these, the first one and the second one, have LOS instead of LPS, and it's cell wall. It's associated with it's one of the top 3 causes of meningitis, and you'll see this with young adults as well. And typically, this is why you are required to get vaccinations before you go live in high density, very crowded areas with a lot of people in them, like college dorms. Also associated with meningococcemia, when it gets into when it spreads to the blood. It's also, if you have repeated infections of this, it usually indicates a particular immunodeficiency, and it usually indicates that you are deficient in some sort of production in your late complement proteins. So our late complement proteins include proteins like C6 through C9 complement proteins, and a deficiency in this will open you up to this specific infection by this specific agent and repeated infections of this. And it's also associated with, if you ever see the trigger word Waterhouse Friderichsen syndrome, it's a possible complication from this as well. Or vaccines for this involves vaccines being built around its factor H binding protein. And it's got a protein called factor H that actually blocks your C3b complement from binding to the bacterial surface. So if it binds it, it can actually evade host invasion as well. So this is going to be your meningococcus, Neisseria meningitis. Okay. The second one, so this ferments maltose and glucose, which is why it fell under. Interesting. Did not put that up there. Okay. So both Neisseria will ferment glucose, but only Neisseria meningitis will also ferment maltose. So M for maltose, M for meningitis. Okay. So if it doesn't ferment maltose, then it's going to be your number one etiologic agent of the number 2 sexually transmitted disease in the U.S., gonorrhea. And it's going to be the etiologic agent of neonatal conjunctivitis, so inflammation of your conjunctiva, your eyes, in neonates, called ophthalmia neonatorum. It's also associated with pelvic inflammatory disease and salpingitis. Can even result in scarring, infertility, or ectopic pregnancies. You'll see trigger words that refer to an acute infection involving mucopurulent discharge. That usually is indicative of this for a otherwise healthy, sexually active person. If you ever see the keywords DGI, that stands for disseminated gonococcal infection. This is going to be your gonococcus. And so whereas Neisseria meningitis will grow profusely on chocolate agar, it'll grow in chocolate agar, and so will Neisseria gonorrhea. It'll pretty much grow like a thick plate on chocolate agar. Thayer-Martin is sort of a modified chocolate agar, so it's got extra antibiotics in it that'll select out for other possible bugs. So Thayer-Martin agar, and the reason why I wanted to kind of revise this is Thayer-Martin is pretty much what you would use for Neisseria gonorrhea specifically because of the sort of selective antibiotics you see there. Okay. And then if it's a gram-negative diplococci and it's not one of the Neisseria, which you can tell because the question stem might say it does not ferment glucose. It's very often confused with Neisseria because it can appear or look very similar to the gram-negative Diplococcus presentation that Neisseria have. But if it does not ferment glucose, it's probably going to be one of the top three etiologic agents of otitis media and sinusitis in young children. It's often also referred to as a gram-negative coccobacillary rod. But again, gram-negative Diplococcus as well. It can also be associated with bronchitis and pneumonia, especially in older adults with COPD. This is going to be nowhere near as common, but still important to consider with identification. It's going to be your Moraxella catarrhalis. And then last but not least, if they describe it as a gram-negative coccus that is anaerobic, so you'll find it in some sort of anaerobic condition or infection. This is going to be your normal flora that you might find in the mouth. Moraxella catarrhalis is going to be upper respiratory. This is more going to be normal flora of the mouth, the colon, the vagina. It's very, very rarely going to cause infections. When it does, it'll cause a rare opportunistic infection. Usually you have to be immunocompromised. But you might see this associated with abscess formation in sinuses or tonsils or brain abscesses. Or you might find this in mixed anaerobic infections. This is going to be Veillonella. Okay, so Moraxella, Veillonella, Neisseria are what three genera you should think of when they mention gram-negative Diplococci or gram-negative cocci. Okay. One thing that I did not mention here that is a coccus is Peptostreptococci, and it's a genera that's a member of normal flora in your mouth. Found some sources that also say it could be vaginal normal flora as well, but it's usually associated with normal flora of the mouth. It's an anaerobe, and you might find this in mixed anaerobic infections. So yeah. And a sort of nuance thing to point out here that kind of confused me at first. When it talks about you can't just think, oh, heart valves. That's going to tell me that it's one thing or another. You have to look at a little bit more of the question stem. So if it talks about an infection involving chronic infections that involve the heart muscle, and the heart valves, then that is most likely going to be your group A strep, your strep pyo, okay? Because of that M protein. But heart muscle is, I mean, it really loves your aortic valve too, but if you see it also involve the heart muscle cells as well, cardiac muscle cells, then it's most likely going to be group A strep. Whereas if it talks about ones that involve previous damage to the heart, or something involving prostate exams in older adults, or prostate surgery in post-op infection, that's most likely going to be your group D enterococci or group D strep. If it involves organic heart valves, whoops, oh, I don't know why it's doing that. Okay, organic heart valves combined with a patient with history of IV drug use, maybe. This is going to be indicative of your catalase positive, coagulase positive. Excuse me. Oh dear. I'm not sure what happened to all of my notes. I think that was a bit of an overload. Okay, so sorry about that. We are just going to have to transition over. I think my Adobe kind of crashed, but I just rewrote it here. So again, chronic heart muscle and valves are going to involve your strep pyo, talking about prostate exams or post prostate surgery with older adults, typically going to be your group D enterococci. Talk of organic heart valve infections, and also in conjunction with IV drug use will be your coagulase positive, catalase positive, Staphylococcus aureus. Whereas if they talk about artificial heart valves or prosthetic heart valves, that's actually going to most likely involve staph epidermidis. And then with heart valves post dental surgery or some sort of oral related surgery or surgical procedure or something like that, or oral exam, that's most likely going to be your Varidan group, okay? All right, well, I hope you found that helpful. If you have any questions, you can shoot me an email, and I'll see if I can post some practice questions with the video or try to attach this worksheet for you to try on your own in the video info. Thanks for watching.